Hi, hello, welcome to our channel. My dear students, today the special topic belongs to obstetrical gynecology. My dear students, it is going to helpful for all the third GNM and fourth BSc students. So here you can see the stages of labor. My dear students, if you want to know what is the stages of labor, you just know what is the meaning of labor. And before going to know what is the meaning of labor, you must understand what is the stages of pregnancy. My dear students, I can tell here the pregnancy or that complete process will be happen within three stages. The first one is antenatal, internatal and postnatal. Antenatal is nothing but before the delivery, with the time duration from the conception period to at the end of the delivery, so that will be called as antenatal. It's nothing but before the delivery. And second one is intranatal. So during the delivery, the process, the time duration is called as intranatal. And third one is postnatal. So postnatal is nothing but after the delivery, the time duration up to the 6 weeks is called as postnatal. My dear students, so these are the three categories we can observe: before the delivery, during the delivery, after the delivery. I hope you understood. And next we can see, as I told you, prenatal. I mean before the delivery, before the birth. So what are the stages are there? So this we can consider as three kinds of the trimester, whereas first trimester, second trimester, third trimester. The first trimester is including of 3 months: first month, second month, third month. So how it is considered of weeks? So 1 to 4 weeks is called as the first month, 5th to 8th week is called as second month, 9th to 13th week is called as third month. So these 3 months is called as the first trimester. My dear students, the first trimester is belongs to the antenatal. The second trimester is belongs to the fourth month, fifth month, sixth month. So this 3 months is called as second trimester. How the fetal development is going to happen, you can able to see in the picture. And next one is a third trimester. So third trimester will be 7th month, 8th month, 9th month. So these 3 months is called as third trimester. So here I am telling the first trimester, second trimester, third trimester is belongs to antenatal time, and it is the three trimesters belongs to prenatal, before the delivery. So I hope you understood this point. Let us see, there is a different kinds of the labors are there. I can tell that pre-labor and term labor, prolonged labor. So what is the meaning of premature labor? What is the meaning of term labor? What is the meaning of prolonged labor? My dear students, as we know that at the starting of LMP, at the first day of the LMP, up to 24th, 28th, 37, during these weeks, if the delivery is going to happen, if the labor is going to happen, that will be considered as preterm labor. Next one, if it is the labor is going to happen at the week of 38 or 40, that will be called as term labor. So here term labor is called as normal labor. At the week of the 38, at the week of the 40 week, if the mother is getting the delivery, that is called as normal delivery. In that case, the baby, the development, the physiologically, psychologically is should be good. So that will be called as term labor. What is the meaning of prolonged labor? Due to different kinds of the problem, physiological problem, due to some hormonal imbalance, the labor may extend. It might be the 42 or 43 weeks of the term. In that case, that will be called as prolonged labor. My dear students, so here the three kinds of the labors we have seen. So this is about the stages of labor. Let us see, so what are the main stages of labor? So here first stage of labor, second stage of labor, third stage of labor and fourth stage of labor. My dear students, that labor is categorized as four kinds of the things: first stage, second stage, third stage, fourth stage. Let us see each and every stage. Before going to that, you must understand the what is the meaning of primary gravida, what is the meaning of multipara. So here primary gravida or multigravida is nothing but when the mother is getting first pregnancy, when the mother is getting first delivery, it should be called as primary gravida. The time duration for this 20 hours to upper limit and 12 hours average time duration for the delivery, minimum to maximum time. Whereas the second delivery, the second mother which is going to undergo the delivery, that should be the time duration average must be 14 hours to 18 hours. So this is the average time duration for the labor. My dear students, let us see the first stage, how it is going to happen, second stage, third stage and fourth stage. The first stage of the labor, what is going to happening exactly? So here the first stage of labor will be start onset of true pains. So you must understand what is the meaning of true labor pains and what is the meaning of false labor pain. So regarding that I will take next session, but the thing is, so first stage of labor will be start onset of true labor pains. So when there is a mother is getting the pains, that seems there is a starting of this labor. Okay, so that will be called as true labor pain. It will be recurrent, continuous pain will be occur. There is a rupture of layers also we can observe. There is a fluid leakage also we can observe. This kind of the symptoms we can observe in the case of the true labor. Is it? So that is the meaning of starting of the first stage with true labor and ends with the fully dilatation of the cervix. The cervix will be dilated in the two kinds of the stages. The first stage is called as latent phase. The second one is called active phase. So here the first phase, the cervix is going to dilate up to 3 centimeters. So there is a different kinds of the aspects is factors affecting the dilatation of the cervix. In such case, the first main factor is oxytocin, is one of the hormone is helpful for the dilatation of the cervix during the labor, during the first stage of labor. So here 0 to 3 centimeters dilatation will be occur at the phase of latent phase. Whereas second phase, the 4 to 10 centimeters of the cervix dilatation we can observe, that will be called as active phase. So this latent phase, active phase, these two phase we can observe in the first stage of labor. My dear students, the first stage of labor will be starting with true labor pains and ending with fully dilatation of the cervix, mostly 10 centimeters. So here, if it is the first stage of the labor is going to take a time duration, if it is a primary gravida 12 hours, if it is multipara 6 hours. As I told you, primary gravida it will take lot of time for dilatation physiologically, whereas so 6 hours will be taken for the multipara. So this is the first stage of labor. And second stage of labor, it will begins with the complete dilatation of the cervix and ends with the delivery of the baby. This is very precious stage during the labor. We must pay most attention on it, because once the second stage of the labor is going to happen, the delivery will be occur. The fetus will be occur delivery. So here, once the delivery is going to happen, immediately there is a fetal resuscitation will be happen. Neonatal resuscitation will be happen. So what are the things we must do? Immediately delivery. So that session also I will explain the soon. But the thing is, the second stage will be fully dilatation and ends with fetus delivery. The baby will be delivery. So primary gravida, we can see the time duration. Primary gravida will be taken off this 3 hours. Multi gravida will be taken off 2 hours or 2 to 30 minutes. So this is the time duration for this second stage of labor. Let us see the third stage of labor. So second stage of labor, we have seen that the fetus is expelled, delivery is completed. My dear student, the second stage is once the delivery is completed, once the baby is expelled, what is the remaining part within the mother womb? Nothing but placenta. So we must take out from the uterus that placenta. So how we are taking the placenta? What are the methods we are using for getting out of the placenta? There are the different kinds of the methods are there. Manual method, different kinds of the methods are there. By using that, how we are takeouting. After that, how we are observing this placenta. Placenta observation examination is very important in order to get the further, in order to prevention of further complication. My dear students, so third stage of labor is going to be begins with delivery fetus and ends with placenta expulsion. The placenta expulsion, the main element, we can see the third stage of labor. So it is at average time 30 minutes or less time is 15 minutes. So this is the things will be seen in the third stage of labor. Let us see what is the fourth stage of labor. My dear students, once the baby is expelled, once the placenta is expelled, so what is the thing we must do? That is a fourth stage of labor. So what is it going to happen in the fourth stage of labor? Nothing but complete observation of mother and as well as baby also. So what is the vital status? What is the position of the baby? So that will be, it is a 1 hour complete observation after the delivery. So that will be called as fourth stage of labor. So here we must observation of the baby as well as mother also. So these are the 4 stages. So superficial I explained. So these are the 4 stages we can observe in our labor. So first stage, second stage, third stage, fourth stage, what is going to happen and how much time duration? This time duration is very helpful for your competitive exam, and from which time to which time, which aspect to which aspect is going to happen in the particular stages, that will be useful for your knowledge as well as future competitive exams also. So the 4 stages are there. Each stage is have different kinds of the aspects. My dear students, today class session is very helpful those who are going for competitive exam, as well as today part is very helpful for the your theoretical exam purpose also. My dear students, if you want to get this kind of the sessions in future, please like, share and subscribe. It will be useful for them. So I will come with next session. Until that, stay tuned. Thank you so much for your pay of attention. Thank you, my dear students.